want to do some research into what can help prevent COVID, what to do if you get COVID, and some natural remedies, some natural things you can do, and also some pharmaceutical things that can be done because we want to do everything we can to help resolve it, prevent sickness and mortality. Right now, we wanted to look at fever. Fever is actually one of the God's given systems to turn on our immune system so that we can fight infections, that's bacterial and viral, as well as cancers. It is turned on to turn on our immune system to fight those things. The next presentation after this one is going to look at a protocol developed by the Frontline COVID Critical Care Alliance. It's a group of specialists who have reviewed the literature to find out what does work and what doesn't work. We'll be looking at some pharmaceuticals, one that does, some that don't, looking at the meta-analysis so that you can get a feel for what works. And also we're going to be looking at some vitamins, vitamin C, vitamin D, and others that have been shown to actually be helpful in preventing and treating the infection. So we're going to try to cover a lot, and then we'll this afternoon we can actually cover another one, sleep, just something that your body needs to help build your immune system and strengthen it, or we can be looking at some other phytochemicals that can be useful. So this is the powerful immune stimulant called fever, and I always like to start with a short prayer. Dear Father, I pray that you can be with us today as we look at your means of combating infections. We pray for your presence in Jesus' name. Amen. Okay. Well, we're going to look at fever, the natural system in your body, and also hyperthermia, which is where we create an artificial fever to get the same benefits that fever produces. Is this approach effective? Well, we're going to look and see. Actually, what about viruses? COVID is a virus. When did we first learn about viruses? Actually, it started with Louis Pasteur. When he was developing the anthrax vaccine, he could look under the microscope and see the anthrax bacteria. But when he was developing the rabies vaccine, he couldn't see anything there. He dissected it, microscopes and everything. And so he said it must be an organism infinitesimally small. Today we know they're viruses. He identified them back in the 1800s. Another evidence of a virus came in 1892. Iwanowski, he took a leaf of a tobacco plant that had tobacco leaf disease. He ground it up, put it in water, and then he filtered the water through a porcelain filter. Now, porcelain filter will filter out blood cells, it'll filter out any living cells and bacteria, but it's not small enough to filter out viruses. So he passed this fluid through a porcelain filter. By the way, you can get porcelain filters today at REI or any camping store to filter your water when you go camping. It's very effective. He passed it through this porcelain filter, took the water that came out, put it on another healthy tobacco plant, and it got tobacco leaf disease, indicating that something was transmitting the disease from one plant to another that you couldn't see under a microscope. We have a series of lectures we do at lifestyle centers, things that can help stimulate and strengthen the immune system. We give these lectures mainly to cancer patients who want to strengthen their immune system, and there's a whole host of things that can help do it. And once the immune system is strengthened, then we talk about fever that can turn on the immune system so that it starts working. So, how do fevers turn on or stimulate the immune system and thus aid in combating infections and cancers? I'm indebted to Matt Kluger, who did much of the early research into the benefits of fever. Today, fever is perceived as something that needs to be suppressed. However, historically, it was perceived as something beneficial. Hippocrates, 400 BC, he wrote, "Nature never needs any instruction." He wrote that during an ulcerative eye infection, a fever supervening is a favorable sign. It's a good thing. It means infection is going to clear. Rufus of Ephesus, 100 AD, said, "I think you cannot find another drug which heals in a more penetrating manner than fever. For this reason, it's a good remedy for an individual seized with convulsions, and if there were a physician skillful enough to produce a fever, it would be useless to seek any other remedy." In the 1600s, Thomas Sydenham, the physician, said, "Fever is nature's engine which she brings into the field to remove her enemy." And then Liebermeister in 1887, he also thought fevers of moderate magnitude or high magnitude for short periods of time were beneficial. Today, there is widespread trend to reduce fevers with antipyretics. I get calls from the hospital saying, "Patient's got a fever, should I give an antipyretic?" Because they feel they're not being a good nurse if they don't. Kluger wrote that one might survive from this widespread attempt to reduce fevers that convincing evidence had been presented that demonstrated that fevers were harmful. This is not the case. If anything, the weight of evidence tends to support the opposite conclusion. That is, that fevers are beneficial. What is that weight of evidence? By the way, the view of fevers from being beneficial to being harmful actually came about around the 1950s. You know what happened in the 1950s? Exactly, they developed antipyretics. So I'll let you draw your conclusions. In the late 1800s, Louis Pasteur was studying anthrax. Okay, we studied this one. And what he found was that he could give anthrax to cows and sheep, and they would be dead in a few days. But when he injected it into chickens, they ignored it. I thought, what is the difference? Why don't the chickens die of the anthrax? Well, he observed very carefully the temperatures, cows and sheep. They were around 100 degrees Fahrenheit. But when he looked at chickens, they had a temperature constantly of around 104 to 108 degrees Fahrenheit. And he thought maybe the chicken's higher temperature is what protects them from the anthrax. So to find out, he took a chicken, wired his feet to a screen, put him in a cooling bath, dropped his temperature down to 100 degrees Fahrenheit, injected him with anthrax, and in 24 hours it was dead. He took another chicken, did the same thing, injected him with anthrax in a cooling bath. In a few hours he started to feel lethargic, head drooping. He showed anthrax toxicity. At that point, he took him out of the bath, dried him off, warmed him up. Chicken survived. Interesting. It's and this was one of my first evidences that struck me. I said, wow, just a few degrees Fahrenheit was the difference between life and death. It wasn't a small improvement. This was a major effect. Another more striking example was found in around the turn of the century, around 1900s. And it was first actually described by Hippocrates, who wrote in around 400 BC that there was a mysterious progressive paralysis that would leave the victims paralyzed. But he observed that in rare cases, if they got a fever from some other cause, the paralysis would go away and they would recover. It wasn't until 2,000 years later, in 1858, that Esmark and Jensen showed that this progressive paralysis was caused by syphilis, a little spirochete that they could see in the blood under the microscope. In 1887, Wagner Jerrig, he was a psychiatrist who was studying neurosyphilis, and he read what Hippocrates said about a fever being beneficial, and then he noted that in India and in China, syphilis was endemic. It was rampant. but they very rarely got paralysis from it. And he wondered why. What's their secret? Well, he also noted that malaria was rampant, and he thought, well, maybe the fevers from malaria were treating the syphilis. So he did the next logical thing. He took 9 patients who had who had syphilis, neurosyphilis, paralysis, injected them with malaria. They got fevers, and 3 out of the 9, paralysis went away. We don't do that today, but that's what they did back then. And then they would treat the malaria. I thought, wow, this is a bit strange. However, before malarial treatment, only 1% of neurosyphilis patients went into full remission. With this malarial treatment, they had about 30% success rate on thousands of patients. Now, I thought, this is a bit strange. Doesn't sound like malpractice. But someone didn't think so, because in 1927, he got the Nobel Prize for treating syphilis with malaria fever treatments, essentially. Have other diseases been treated with fever therapy? Actually, the typhoid vaccine was used to treat resistant forms of gonorrhea. Give the typhoid vaccine, they develop a fever, and the gonorrhea would get better. That was in 1943. However, there were side effects. This gram-negative bacteria, some cases not only produce fever, but septic shock, which is a serious problem. And needless to say, we don't do that anymore. Polio, also another viral infection, was treated successfully with fever baths as per report from one of our lifestyle guests. His mother and aunt both had contracted polio. His mother received fever treatments, recovered. His aunt did not, and was left with some residual paralysis. Is there more recent evidence that fevers are beneficial? Actually, yes. In the 1970s, Matt Kluger did controlled trials on the effect of fevers in infected animals. His work was summarized in 1984 in the prestigious journal Science. To study fevers in animals, he had to come up with an animal that he could produce a fever in or suppress a fever in. And during a boring lecture, it occurred to him, I need a lizard. Because a lizard is an ectoderm. The only way that fever can generate a fever is to move into the sunlight, and that raises his temperature, and then when he's cured, he can go back into the shade. So in his study, he took a group of lizards, put a little thermocouple in their rectums where he could measure their temperature, and they ran around the sand. He had a sun lamp in one side and shade in the other, and the lizards ran into a place where they were 38 degrees Celsius, and that was where they were comfortable. Then he infected them with Hydrophila bacteria, and they all migrated up into the sunshine, into the heat lamp, temperature raised to about 40 to 42 degrees Celsius. That was a fever for the lizard. Once they cleared the infection, they moved back into the shadier areas. Temperature dropped back to 38 degrees Celsius. This was their way of generating a fever. Well, in a later group of lizards, he infected them with Hydrophila bacteria, and he maintained them at different temperatures. He put light on some, shaded the others, and he found that, oops, I'm missing one. Here we are. I got a pointer. Is it going to point? Okay. He kept the lizards at different temperatures. One group he kept at 42 degrees Celsius, and this is their mortality rate. At 3 days, 95% survival if they were allowed to generate their normal fever at 42 degrees Celsius. In another group kept at 40 degrees Celsius, they had about a 70% survival. And if he kept them at 34 degrees Celsius, they all died by 3 days. You think, well, why didn't God design lizards to have fevers all the time? Well, there's a problem, because to generate a fever, your metabolism is racing and it will use up your reserves. And that's what happened. If they kept the lizards at that higher temperature for more than 3 days, they started dying. They weren't dying of the disease, they were dying of exhaustion. So the way it's designed is that we only go into a fever when we have an infection and need that extra immune system functioning. And then as soon as that infection is gone, body drops back to healthy temperature again, a lower temperature to conserve calories. What if we take a lizard and suppress their fever with aspirin? Well, they took a group of lizards, and half of them they put an infusion of aspirin. And what happened was those that got the aspirin did not, their thermostat was prevented from being reset higher. So they had no desire to go into the heat under the sun lamp. They stayed in the shade. Their temperature was maintained at their normal body temperature, and they were all dead in 3 days. Whereas the ones that were allowed to maintain a higher temperature, they didn't get the aspirin, they survived. Similar effects were found in goldfish. How do goldfish generate a fever? I don't know if you've ever been in a lake and you jumped in a lake, the deeper you go, the colder it gets. So they did just suggesting the fish, instead of being at a lower level, would just go to a higher level. That was a warmer temperature of water. That was their fever. They would fight the infection, then go back down to a colder level. If the fish were infected with Hydrophila bacteria and allowed to go to the higher temperature, which for them, a fever was 32.7 degrees Celsius, they had very good survival, 95% at 3 days. But if the lower the temperature, the lower is the survival. And at 25 degrees Celsius, only 20% survival after the infection. Now, we've been talking about reptiles and fish. Are there benefits in mammals? Because that's a different creature altogether. Well, there was a correlative study done in 1977. Ferrets, which are mammals, were infected with an influenza virus. The presence of the virus was determined by assaying the washings of the nasal cavity every 4 hours. It's kind of like the COVID test. You go into the pharmacy and they give you a nasal swab and they test it for COVID. That's what they were doing with the ferrets, with the influenza. Rectal temperatures were monitored, and they found that the higher the rectal temperature, the faster the virus cleared from the nose. And these findings were statistically significant. Another study was done with newborn mice. In newborn mice, an infection with Coxsackie-B1 virus is usually fatal. However, if the mice are 8 to 9 days old, their temperatures are higher, the infection is much less dangerous. So in this study, newborn mice were infected with Coxsackie-B1 virus, and then some of them were incubated and some of them were not. When they incubated them, brought the temperature up to 34 degrees Celsius, they maintained this body temperature for 8 to 9 days. And they had a much lower mortality than the mice kept at 22 to 24 degrees Celsius. So newborn mice, which would normally die of the influenza virus, survived by allowing them to have a higher temperature. By the way, for puppies and for mice, they only develop the ability to generate a fever at about 2 weeks, 10 to 14 days. So newborn puppies and newborn mice are susceptible to viral infections. If newborn puppies, herpes canine virus is always fatal if the puppies haven't received the maternal antibody protection from their mother's milk. In dogs 2 weeks or more old, the infection only causes a mild inflammatory upper respiratory syndrome. They get a little runny nose. That's it. What's the difference between 2-week-old puppies and newborn puppies? Well, again, the 2-week-old puppies can generate a fever. They have higher temperatures. So they wanted to see, is this higher temperature what makes the difference of death or survival? So they took newborn puppies, they inoculated all the puppies with herpes canine virus, and kept and some were kept at the normal newborn rectal temperatures at 95 to 98 degrees Fahrenheit. These all died in 5 to 8 days after the inoculation. Other puppies were inoculated and incubated to maintain a rectal temperature which was elevated at 101.5 to up to 103 degrees Fahrenheit rectal temperature. They all survived by 9 days or longer. One died at 9 days, one on day 10, but the others continued to live. One was sacrificed on days 13, 16, 21, and one was given away as a pet and is still alive on day 600. So again, a few degrees Fahrenheit made the difference between life and death for these newborn puppies. They did pathological studies on the unincubated puppies, the puppies that were at the lower temperature, and showed widespread focal necrosis, little areas of dead tissue throughout the body, and then some hemorrhage, bleeding throughout the body. The lungs showed mild congestion and a few areas of consolidation and some necrosis or death. The 2 incubated puppies that died demonstrated only a few minute petechial hemorrhages in the cortices of their kidneys and moderate pulmonary congestion, much less pathological changes than were seen in the unincubated puppies. That is, they had markedly less tissue damage than the unincubated puppies. The sacrificed animals showed barely visible petechiae, or little hemorrhages, in the renal cortex, and one had only mild congestion and congestion in one area of the lungs. So, newborn puppies who don't yet have thermal regulation in place, inducing a fever with incubation protected them from most of the ravages of the herpes canine virus. Now, let's look at older puppies. These are now adult dogs, and they have their thermal regulation in place. And they're normally immune to the effects of herpes canine virus due to their higher temperatures. What would happen if we gave herpes canine virus to these dogs and then anesthetized them and reduced their temperatures? Well, that's what they did. And they found that the ones that were allowed to maintain their normal temperature or febrile temperature showed no evidence of damage when they did autopsies, when they sacrificed them. They could not isolate the virus from the tissues. The other dogs that were tranquilized and kept at a lower temperature, 94 to 97 degrees, for 45 to 48 hours, on pathological exam, these dogs, the virus was readily recoverable from the liver, the spleen, with lesser amounts found in the lymph nodes, lung, kidney, and adrenal tissues. The virus was spreading. Next pathological study they did was to use fluorescent antibodies which would adhere to virally infected cells. In hypothermic dogs, the numerous discrete fluorescent foci could be seen in the liver, spleen, and the kidney. In the dogs that were kept at the normal temperature, they found no fluorescent cells. The virus had not attached to these cells. Okay, so that's the benefit of fevers in animal studies. So let's look at what causes a fever to begin with. Well, your body was designed by a creator to produce a fever when infected. Here, when tissue becomes infected, when tissue becomes infected, these are E. coli's. When they become infected, they stimulate the white cells. And the white cells are turned on, and they produce interleukin-1. Interleukin-1 stimulates the production of prostaglandins, which then go cross the blood-brain barrier and go backwards. Okay. They go across the blood-brain barrier, and it resets your thermostat higher. And that higher thermostat set point is then what generates a fever. This is how it works. When the body gets infected, it resets Here's your normal body temperature here. When you get infected, the body resets its thermostat up here. Your body then feels cold because your body temperature is now below your set point. And so you feel cold. And so you shiver to generate heat, and you put on a blanket. This raises the body temperature up to 102. Now, if somebody touches you, they say, wow, you're burning up. Don't you feel hot? You say, well, no, not really, because your temperature has matched your new set point. So temperature-wise, you feel comfortable. Do you feel exhausted? Yes. You feel exhausted because to generate that higher temperature, your metabolism is racing. It's like climbing a mountain. And that's where the discomfort from fever comes from. It's exhausting. Of the food you eat, 3/4 of the calories you eat go to keeping your body warm. Only 1/4 is delegated to moving, thinking, generating, making proteins and things. By comparison, a very small portion. So the major portion is keeping your temperature, you're keeping your body warm, and so an increase in temperature is going to be exhausting. My wife and I, we got COVID about a month ago, and the fevers, we felt comfortable temperature-wise, but we were exhausted. There was just no energy to do anything, and that lasted for a week or two. When the infection is cleared from the body, however, the thermostat is reset down to 98.6. Now we feel hot because our temperature is 102, but our thermostat is 98.6. So we throw off the blanket, we break out into sweat, and that drops our temperature down to the new set point. In the old days, if one of the children got sick, had a fever, as soon as they saw the sweat break out, they said the fever's broken, they're going to get better. They knew that the infection was clearing and the inflammation was going to decrease. So how do fevers help fight infections? Well, there's several mechanisms at play. The simple one is to think that, well, maybe the higher temperature is killing the bacteria outright, like boiling them or something. Many bacteria grow slower at febrile temperatures. That's true. Some strains of pneumococci are killed outright at temperatures as low as 41 to 41.5 degrees centigrade. That's 106 degrees Fahrenheit. Rabbits maintain a normal temperature of about 103, and their fevers can go as high as 107, which is enough to kill pneumococci outright. Can fevers help the body fight viruses? Febrile temperatures have a direct inhibitory effect on most viruses. Polio virus, for instance, is inhibited directly by febrile temperatures. Poliovirus grown at a temperature of 104 degrees Fahrenheit were 250 times smaller than those grown at the lower temperature of 98.6. The viruses are not destroyed by the heat, but their development was impaired. It's felt this impairment was due to the heat effect on the DNA and the RNA for these viruses. So remember that fever therapy was used successfully to resolve many cases of neurosyphilis resistant to gonorrhea and resistant forms of gonorrhea. Are febrile temperatures enough to kill syphilis and gonorrhea outright? For gonorrhea, the answer could be yes. Gonorrhea are very sensitive to temperature elevations. They're killed outright at a temperature of about 104 to 106. However, the direct effect of high temperatures is unlikely to be a mechanism for killing syphilis. They require temperatures over 106 degrees to kill them. And the malaria fevers that were generated that were successfully killing the syphilis, those malaria fevers were not high enough to kill the spirochete directly. So the question is, well, how did the fevers kill them if the temperature wasn't killing the spirochete? Well, they believe it was because it stimulated the immune system to kick into high gear, and that's what killed the spirochetes. So what happens when you have a fever to the immune system? How is it turned on? Well, T lymphocytes are white blood cells with antiviral and anti-tumor properties. When an infection occurs, the fever works to enhance the T lymphocyte activation and proliferation in order to fight the virus or the tumor. Studies by Gordon and Duff and Scott Durham at Yale showed that T cell production increases by as much as 20 times when the temperature elevates from 98.6 to 102 degrees Fahrenheit. Lymphocytes are also activated to fight viruses more readily at the higher temperatures. So your T lymphocytes increase production and increased activation. What about interferons? Well, interferons, they're proteins which exert antiviral and anti-tumor and antibacterial actions. Before we had one of the latest drugs for hepatitis C, we used interferon. And interferon, you get it in injections, and it would help fight the viral infection of the liver, maybe 50% success rate. Now we've got antivirals that give you like 98% success rate. But back then, that was all we had. And interestingly, the interferon, the side effect was generating a fever. Interferons helped to generate a fever as well. Interferon becomes more than 3 times as effective in fighting viruses in tissue culture when the temperature goes from 102 up to 104. So fever stimulates interferon production and it activates the interferon, makes it more effective. Well, here we have a white cell. It actually appears yellow here, and it's gobbling up an anthrax bacteria. That's the orange rods here. That's called phagocytosis. Once the rod is ingested by the white cells, then little vacuoles with lysosomes in them, they bind to that swallowed bacteria and kill it. Phagocytic activity, that is the gobbling up of bacteria, increases dramatically at higher temperatures in some studies. White cell mobility, that's called the mobility of the white cell, is markedly increased as you go from 95 degrees Fahrenheit up to 104 degrees Fahrenheit. Some bacteria are killed more efficiently once ingested by white cells at the higher temperatures. Another thing fever does is lower the iron concentration in the blood. Why would a fever do that? Well, it turns out that many bacteria need iron to grow and live. At higher temperatures, the bacteria's cytophore system, which helps it eat the iron or take it into the cells, is compromised, and that helps kill the bacteria. Also, during the high fevers, the white cells release a substance which binds to serum free iron to lower its concentration, thus making it unavailable to the bacteria, further weakening the bacteria. In fact, in residency, we learned of the iron deficiency of chronic inflammation. It's a chronic anemia of inflammation. If you have chronic inflammation, you'll have a low iron count. And back then, we didn't really know why that was happening, but now it appears that we have an explanation. Fevers act by these 2 mechanisms, lowering the iron amount and preventing the bacteria from absorbing it, to kill Salmonella typhi. Here's a desert iguana. He uses this technique to survive Hydrophila bacteria. It was found that if Hydrophila bacteria is injected into a lizard, that their iron concentration drops by 30%. They found that if they grow this Hydrophila bacteria in media, if they raise the temperatures from 38 to 41 degrees, there's no effect. But if they decrease the iron in the media and raise the temperature, then there's a marked slowing of the growth. Similar results were found in rabbits infected with Pseudomonas maltosidi. So, to review the benefits of fever in fighting viruses, they found, here's an article, they found that at higher than physiologic temperatures, binding of bivalent antibody can neutralize pycnoviruses by reversibly neutralizing the virus through disruption of the virion, which leads to ejection of RNA. Fever enhances this process, confirming the popular belief that of the virtues of fever. So what this is saying that fevers are helpful in fighting viruses. Oh, there it is. Okay. Are there human studies demonstrating the benefit of fever in infectious diseases? Yes, this is a fascinating study which looked at over 130,000 patients admitted to the intensive care units in Australia, New Zealand, and the United Kingdom, England, with the diagnosis of infection. They wanted to determine whether fever is associated with an increased or decreased risk of death in patients admitted to the intensive care unit. So they recorded the peak temperature the patients attained during the first 24 hours of admission. What did they find? Well, in the Australia-New Zealand cohort, adjusted in-hospital mortality risk progressively decreased with increasing peak temperature in the patients with infections. That is, the higher the temperature, the less mortality there was. The lowest risk was at temperatures of about 102.2 up to 102.9. However, in patients without infection, mortality actually increased with increasing temperature. This is because if you don't have an infection, you don't need the inflammatory response. But if you get it, that higher temperature will burn up your energy reserves faster and increase mortality. So you only want a fever if you need it. Okay? You don't want to produce a fever if you're trying to conserve calories. Okay, well, can we generate an artificial fever to fight a virus like, say, COVID-19 virus? I want to cite an account of that being done during the 1918 Spanish flu epidemic, which is in some ways is similar to the COVID viral infection epidemic we have now. This was written by Dr. Charles Marcel, a friend of mine. He's assistant medical director at the General Conference. And Elise Harbolt. It's entitled, Adventist Schools Beat the Spanish Flu. When the deadly flu descended upon the Adventist Academy or Seminary in Hutchinson City, Minnesota, the outlook looked grim. The Spanish flu was known to be usually fatal for young adults. But surprising things happened as the evidence by this report validated by the town's health officer. At least 120 people on campus were exposed to the flu, all housed under one roof. Although 90 of them developed symptoms, not a single person developed pneumonia or died. These results were remarkable compared to the national and worldwide statistics. This is especially noteworthy since there were no medications available at that time to use for treatment. What treatments did they receive? A physician prescribed them strict bed rest, a regulated diet, and cold hydrotherapy, hot and cold hydrotherapy. They would do the fever treatment and then give them cold, fever treatment, and cold. And a nurse gave these treatments and then monitored their care. The patients were required to remain in bed and follow social distancing for up to 2 weeks after recovery. The success attributed to hydrotherapy was also reported on other Adventist campuses, including Southern Missionary College, now Southern Adventist University, and South Lancaster Academy. According to an account of the South Lancaster Academy, while the majority of the cases were of mild type, some were very serious and would undoubtedly have resulted in fatalities. But hydrotherapy treatments applied by the students' hands under the direction of one of our own physicians wrought marvels in the speedy recovery of our most difficult cases. Doctors who had patients dying day by day marveled at the fact that in our large and crowded dormitories with practically no professional nurses in attendance, we had no fatalities. For ourselves, we attributed under God to the fact that we put into operation the methods of treating sick, which for years have been part of our denominational belief. Not only are we grateful for the recovery of our sick, but we believe the experience we have passed through as a school has deepened our faith in these God-given principles. Undoubtedly, other natural remedies, such as fresh air, sunshine, good diet, physical exercise, and adequate sleep, also played an important role in these outcomes. Now, it's fascinating, in a fascinating report called Sanitarium Treatment of Influenza, data was collected from 10 Adventist sanitariums in different parts of the United States that used hydrotherapy as part of the treatment for Spanish flu. In total, 1,123 patients were included in the report. Of these, 446 were treated as inpatients, 677 were treated as outpatients. Only 1.3% of inpatients died. Of those treated as outpatients, 3.8% died. These numbers seem consequential since the death rates for the general public for in-hospitals were 13%. That's 10 times higher than in the sanitariums using hydrotherapy. And at home treatment, instead of 3.8% dying, they had 40% death rate. And the death rate for soldiers at the U.S. Army Hospital, considered the most advanced treatment centers in that time, was 6.7%. We counted the significant lowered mortality rates due to this. They said the principal merit as far as treatment was concerned was placed in careful nursing and hydrotherapeutic remedies. Okay, so if you want to do hyperthermia or hydrotherapy, if you have any of these medical conditions, you need to consult your doctor. Neuropathy, that's diabetic neuropathy, because you can't feel with your feet the temperature of the water and you can get burned. Peripheral vascular disease, it increases metabolism in a foot, and if you don't have good blood supply, that can be a problem. Cancer, heart disease, high blood pressure, HIV infections, diabetes, prior problems with hydrotherapy or pregnancy. Those who are unconscious or mentally compromised because of illness or drugs or alcohol use cannot feel heat and should not be given hot water temperature procedures. A water temperature is best tested with a thermometer and should not exceed 110. We use 110, sometimes up to 112 degrees Fahrenheit. Put patients in a hot tub. As the temperature rises, it takes about 20 minutes. We shoot for 102 degrees Fahrenheit, oral temperature. Try to keep it there for 20 minutes. And then once it's there for 20 minutes, then they pull them out, keep them warm, wrap them up in a blanket, and try to keep them warm for another 40 minutes so that they have a high temperature for about an hour. It is exhausting. Afterwards, you just want to sleep. The other time that you would hesitate to use hyperthermia is in a person with heart disease or in anybody who has a poor exercise tolerance. Anything that would prevent their heart from working harder. If they're restricted from running or climbing a mountain, something of this nature, fever treatments have the same kind of physical stress. And so if you're going to stress the heart the same way you would if they were climbing a mountain. So that's the only real caveat that you have to be concerned about. My wife used hydrotherapy. We used it for her. And she had metastatic breast cancer, gone to her axillary lymph nodes. They did surgery, and following that, they didn't get it all. She had lymph node involvement. We did hydrotherapy for 6 weeks. When she went back for further surgery, the lymph nodes were clean. So it is, we use hydrotherapy for infections as well as cancers. Can it be used for minor viral infections? Yeah, actually the first time I experienced it, they asked me to cover for a lifestyle center up in Michigan in February because the doctor wasn't there that month. So I went up there, and they have you walk with the guests outside for their daily walk. And when I got outside and walked with the guests, it was so cold I realized why the doctor wasn't there that month. At any rate, I started getting a cold, and I didn't tell anybody about it, but they said, oh, by the way, we have a light box. Why don't you try it out? It's a new light box. I said, oh, okay. And it was just a simple box. Your head would come out the top, light bulbs in it. And I got it, and I think, I had a bathing suit, and I thought, what are these lights? This is just little 100-watt lights. That's not going to do anything. Well, in 5 minutes, I was breaking out in a sweat. And they kept it there for, I don't know, 5, 10, 15 minutes. And I got out, took a shower, and I wasn't expecting any response, but the next day my cold symptoms were gone. It resolved it. These are things that can be done at home. If you want to do the simplest form of fever treatment is when you get home, you get in your bathing suit, sit in a chair, and put your feet in a tub of hot water, and then get an electric tea kettle and put it under the chair so that steam rises up under the chair. Be sure it hits the chair and you don't burn yourself, anything. Then you take a blanket or sheet and you wrap it around yourself and you trap the steam under that tent, so to speak. That steam, it sounds like it would be ineffective, but that steam will actually, if you've got a good electric kettle, will cause a fever. You'll actually break out in a sweat, and you can do a fever treatment with as simple a means as that at home for simple colds. What's that? What about sauna? Saunas can work as well. Yeah, just do a sauna. I would encourage you, if you want to be effective, I would check your oral temperature and try to get it up to 102. That would be the goal. One thing we found at lifestyle centers is the quickest way to get the temperature up is in a water bath, where you get in a bathtub, because the water itself has a very high specific heat. And that's why I can be in air at, say, 70 degrees and feel comfortable, because the air has a very low specific heat and it's not pulling my temperature down to 70 degrees. But if I'm in water at 70 degrees, that water has a high specific heat and it will pull my temperature down to 70 degrees. I'll feel cold very shortly. And that's why in a water bath, if you have it at 110, it will bring your temperature up, usually to about 102 in about 20 minutes. If we use a steam bath, it takes about an hour. So at Lifestyle Center, if you're doing this at home and you've got an hour, that's great. But at a Lifestyle Center, we got a lot of patients to treat. You want to get the temperature up as quick as possible and then maintain it for an hour in a bed afterwards. The other thing to remember is that with a fever, your thermostat is set at 102, and so when the temperature comes up, you feel comfortable. In an artificial temperature, your thermostat is still at 98.6, and when you bring it up to 102, you feel hot. And so it's uncomfortable. You put ice to the forehead to try to help with that. But it's a different procedure, artificial fever, rather than the natural fever. Yes, sir. Drinking fluids is important. Yeah. That will actually help bring your temperature up faster. It's a good point. Also, you want to stay hydrated. It'd be good to drink something, quart of water, before you get in. That will help maintain your blood pressure when you're in the heat. When you're in heat, blood vessels dilate. That can drop your blood pressure. People get lightheaded. So if you drink the quart of water before you get in the fever bath, helps maintain your temperature up. This feeling of hotness, in Germany they actually developed a technique of hyperthermia, which is, it's with infrared lamps. But the problem with infrared lamps is they have wavelengths like ultraviolet, which can heat up the surface of the skin. Infrared tends to go deeper in and heat from inside out. They have found that, and so what you want is the infrared but not the ultraviolet. So they're trying to filter out the ultraviolet. And this is why in the desert, the sun hitting you feels incredibly hot because there's no moisture in the air to filter out the ultraviolets. But in humid places like this, the humidity in the air, the clouds in the air filter out the ultraviolet, and you get a heating rather than this burning sensation. And so in Germany, they got the infrared lamps, and they pass it through a filter of water. It's a thin sheet of water like this, and that filters out the ultraviolet so that when you heat up, you don't feel uncomfortable like you do in the water bath. We had a friend of mine, he was an interesting guy. He was very gregarious. He would witness to anybody, anywhere. and he was actually a window washer at that day. He had his own business. But he would take DVDs into Walmart, and they were spiritual DVDs, spiritual topics. And he'd go to the DVD section, and he'd go up to somebody he didn't even know. I'd say, "Seen any good DVDs lately?" The guy would say, "Nah, they're all junk." He said, "Well, I think you'd enjoy this one." And then he would hand him the DVD. So because of his work, we just let him stay in the back of our mother-in-law house, free. We never charged him. He stayed there for several years. And then when we moved to a lifestyle center, we kind of eventually lost track of him. And then we heard that he had married a businesswoman from China, a multimillionaire. And she developed cancer and wanted to be treated in Germany. So he was flying. They went to Germany to get this treatment. He says, "Dave, let me fly you out here. You can see what they're doing." So I said, "Well, yeah, fine." So he flew me out there, and I got to see them. And when she was getting this ultraviolet treatment, by the way, see, it pays to be nice to people. So when she's getting this ultraviolet treatment, I said, "Are you feel uncomfortable?" And she said, "No, actually not." A very different experience. I've checked with the people that distribute them in Germany. They are not approved in the United States yet, and it may be a year or two before we can get them here. But that would be the ideal option for bringing temperatures up. Any other questions? Concerns? Oh, yes, sir, in the back.
How long should a person go if he or she has a fever before they just had enough and want to take an aspirin? How many days? Or?
Generally speaking, something like COVID, you'll only get a fever usually in the evening. The fever will spike in the evening, and then in the morning, there is no fever. Your body will actually try to regulate your fevers so that you get a transient fever and then it stops. On the other hand, if you have a fever and have congestive heart failure or something that cannot handle that increased metabolism, then you would want to lower the fever, and you would want to do it by antipyretics. Aspirin or Tylenol will bring the temperature down by bringing the thermostat down. You don't want to do what some of the ERs do is put a person in a cold water bath, because if you have a temperature set at 102 and you're at 102 and you put them in a cold water bath, you go down to 98.6, but your thermostat is still 102, what's your body going to do? It's going to work even harder to try to get it up. So it's going to put more stress on your body. So if you're trying to lower your temperature, you don't want to do it with a cooling bath. You want to do it by resetting the thermostat with aspirin or Tylenol. On the other hand, if your fever is a hyperthermia, dehydration, something like this, where your regulatory system is gone and your body is just burning up calories, your thermostat is really out of whack, those people, yeah, you put them in cooling blankets. You want to get their temperature down physically, because you're not dealing with the problem with the thermostat. It's just unregulated. So good questions. Pastor?
Yeah, I suppose this varies with individuals, but how high is too high? Because I've heard, don't get over 104, I've heard 106 kind of problem with some people. How high is too high?
The gold standard is a rectal temperature, which measures more your core body temperature. 102 is the target. If you're doing an oral temperature, that's about 1 degree less, so your target would be 103. If you're doing an axillary temperature, it would be 104. But if you're doing rectal temperatures, which is what the studies that talk about this use, 106 would be the maximum. 107, 108, they have organ damage, liver failure, things of this nature. So that would be 106 rectally would be the maximum. And usually for treating, let me back up. It used to be the thought that it was the temperature that was killing the cancer, why the people were getting good responses. And so they would get it as high as the body could tolerate, 106. Since then, we've understood that it's not so much the temperature that's killing the cancer, it's the immune system that's turned on that's killing the cancer, and you can do that with 102, 104. You can do that at lower temperatures and get that same benefit.
So there's not necessarily any benefit of having a higher temperature.
Not going up to 106 or so, at least in my view. 102 to 104 rectal, or again, change it for oral or axillary temperatures. Yeah. Yes, sir.
Yeah, that bathtub that you had in the picture there, I would be interested in buying one for our bathroom. We have a big bathroom. Could you recommend any particular brand?
A book for hyperthermia treatments, or what?
Well, I have bladder cancer.
Oh,
I'd like to get this tub.
you'd like a book to tell you how to treat it. Boy. Gerson therapy is a start. That would be one place to go. They're not going to tell you about fever treatments. They will tell you about juicing.
I was talking about getting this bathtub and just put it in my house and doing it myself.
Oh, yeah. Talk to my wife. We have actually we do a 3-day intensive for cancer patients where they come, they live at our house for 3 days, and we show them how to do the diet. We give them these lectures, and we show them how to do fever treatments at home, and then we give them a pamphlet. It's a 3-day intensive pamphlet where it describes how to do these different things. If you talk to my wife, she can tell you how to get one.
And after I'm done learning about that, I could do it myself at home.
You can do it yourself at home. Yes and no. Fever baths are like climbing a mountain. So we did it. The first one we did was on a patient who was really kind of sedentary. And when that happens, your metabolism races and the oxygen saturation in your blood can drop, and they become delirious. They'll start confessing their sins like they're getting ready to die. And I thought, oh, not really? And no, it's real. That's what they do. They start confessing their sins because they're getting ready to die. And the oxygen saturation might go down to 80 or 70% when it should be 90 or more. You can get a little pulse oximeter and measure that. If you give oxygen in that case, it takes away the symptoms completely. You can maintain the oxygen level at 90% or more, and they don't become delirious or anything like that. Well, we didn't know that at first, but that is a problem. On the other hand, she had a friend who also had breast cancer who was a runner. She ran every day, and when she got in the fever bath and her temperature rose, she said, wow, this is comfortable, and she started reading a book. So for the first time you do it, if a person is not an active person, we usually like to do it under monitored conditions. So if the saturations drop, we can give them oxygen, or we can pull them out of the bath if they become delirious. If they tolerate it well, some people can give themselves fever baths. I give myself fever baths. If they don't, it would be best for training purposes. When a person comes to our place, we have them bring their spouse or their friend or somebody who's going to be with them, helping them do it. And they both learn together, so that my wife does it the first time, then the second time the helper helps, and the third time the helper does it all, so that we know that they feel comfortable giving it. So just depending on your exercise tolerance, if you've got a great exercise tolerance, you can try it at home. If you don't, you may want to get trained.
I'm walking about a mile every day.
Okay,
I mean, I could try
that's good.
to do something.
If you can walk that mile fast enough to where you're a little bit short of breath, and you do fine with that, you could probably handle it. It would be nice to have somebody there just monitoring you the first time, just to make sure everything goes okay. And you may want to get a little pulse oximeter. Pulse oximeter, it's a little thing that goes on your finger, and It can measure your oxygen saturation. And the last thing is we try to keep the heart rate below 130. And that's another simple thing to monitor. If it goes above that, you may be stressing your body too much, that's all. Yeah, good questions. Other questions? Yes, ma'am.
In Scandinavia, they regularly use saunas as preventative methods, and then they go into a pool with cold water and then come back into the sauna.
Yeah.
They do that like 2 or 3 times a week. I myself have an infrared sauna.
Uh-huh.
I don't do the cold tub, but I use that once or twice a week. So is that similar to doing the fever bath? Or?
Yeah, it will give you the benefits of the fever. Cold water will also elevate your white cell count, just the stress of the cold water. And so the hydrotherapy they did in 1918 was hot water, and then they would do cold, and hot water and cold. And that's probably the most stimulating. We're, for a short effect, at most lifestyle center, well, most places just concentrate on the fever, but there is a benefit to the cold. The other thing that happens is you kind of, your blood vessels have muscles around them which contract and dilate, and you're actually exercising those when you do hot and cold. When you do hot, they relax. When you do cold, they tighten up. And so there can be a benefit to that too.
How long were you sick with COVID?
To what?
With COVID, how long were you sick?
Probably about 2 weeks. Yeah. We're actually going to be talking about COVID in the next talk. These are good questions. There's an incubation phase, an early phase, and then a late phase. And it varies with different people. Yes, sir.
Did you take the COVID vaccine?
I didn't get the COVID vaccine.
You're not going to take it?
No, I didn't want to take it. I don't want to speak against it. Yeah, I mean, it's nice to have vaccines that are good and safe. It's pretty early in the course. I saw a little cartoon. It showed 2 rats talking to one another, and one said, "Hey, did you get your COVID vaccine yet?" And the other rat said, "What, are you crazy? I'm waiting till the human trials are over." So, vaccines can be good things. However, what I'm going to show you this afternoon shows that we do actually have other ways of treating it. And we have actually ivermectin, which shows an efficacy which is on par with the vaccines. And it's another alternative for those that don't want to get the vaccine. I don't have any objection to people getting vaccines. But I just chose not to, that's all. Yeah.
I took the 2 Pfizers.
Uh-huh.
I had no,
Excellent.
I didn't feel nothing.
Good. Excellent.
Like I didn't even take anything.
Yeah. Yeah, and some of the drugs, some of the vaccines, 60%, 65% efficacy. In other words, those that would get infected, 65% are cured. Others have 95% efficacy, and that's a good thing. That's even better. Ivermectin's about 85% efficacy. So, I mean, there are different ways of treating or preventing COVID. I'm going to share with you some. Vaccines are one, and there's some alternatives as well. So, yeah. Yes, ma'am.
Is there a way we can get tested for antibodies?
Yeah, you should be able to get tested with a blood test, and it may take.
Simple blood test?
Yeah, it wouldn't be a nasal washing because the nasal washings can clear when you get over the infection. Another question? Yes, sir.
I've heard, I don't know if it's true or not, what your thoughts are, I've heard that people who get COVID can get it again in 6 months to a year. If that's true, is it due to something going on in the body, or does the COVID simply mutate into another strain on which the body cannot attack?
Yeah, those are good questions. Apparently, there are different strains, and that's one of the problems with the vaccines is they may not hit all the strains, and that's a problem. That's probably why the efficacy isn't 100%. They try to hit the strains that are most common in the area. One nice thing is that your body's innate immune system hits all strains. And so if you have a strong immune system, that will help you no matter what strain you get. And ivermectin, which we'll talk about this afternoon, has antiviral activity which isn't directed toward a particular strain. So yeah, these are effective ways of fighting it. So you've got vaccines, you've got vitamins, and you've got some pharmaceutical means as well. So, well, why don't we take a break, and then after the break, we'll talk about pharmaceuticals and vitamins and that approach and how effective those are. So, okay, thanks for coming.